E aí, gente, boa tarde. Mais uma vez, obrigado pela presença de todos vocês. Vamos começar o segundo Café com Prosa sobre pandemia, né, ao redor do mundo. So first of all, thank you everyone who is here, and thank you to my FMSA friends for accepting this invitation. Today, Maria Luisa, who is the Leo from our local committee, UFSP, will be presenting the Café com Prosa. So welcome, Maria Luisa, and thank you for being here with us as well.
Okay, hi everyone. As Lucas just said, my name is Maria Luisa. I'm from the local committee CLEV UFSP, and today I'm going to be presenting the Café com Prosa of the Europe Regionals. So here today with us, we have Lucia, who's the new assistant from IFMSA Spain. We have Thomas and Camille, who are the news in and out from France, and Sarah, who is the north out from Sweden. Okay. So just a little reminder about the certificate. The link to the attendance will be in the description of the video at the end of the presentation. Okay. So when we're reaching the end of the event today, the form will be available and you can just fill it out. Okay. So I think we can start with Lucia then about her presentation on COVID in Spain. Lucia, you're welcome.
Hello.
Thank you for being here. Sorry.
So I'm going to start. I'm going to share my screen. Well, first of all, I'm Lucia. I'm new assistant for last term in IFMSA Spain. I'm a fourth-year medical student in Autonomous University of Madrid, and I'm from a local committee there in Madrid. So if you come to Madrid, be welcome. I'm going to start my presentation, so I'm going to share my screen. Well, is it working?
Yes, it is.
Okay, so today we are going to talk about the pandemic around the world, and I'm going to talk about Spain, the medical students' perspectives, and I would like to thank our Nori, Maria, because she has helped me to prepare the presentation and all the things. Well, this is like today's agenda. I'm not going to talk about how the virus is transmitted and all that things, so I want to do it like in a short way and talking more about how we have felt it and how we have lived it in Spain. So first of all, we are going to talk about objective data, the quarantine and the lockdown and the phases of the escalation here in Spain, the people awareness of the situation and how they have felt it, the governmental measures, and the medical perspectives of the students. So we are going to start. Well, first of all, here we are going to analyze the objective data. What we understand by the objective data is like the cases and how the curve has worked. Well, first of all, I want you to see that we have like a very huge peak here. The first peak, it was like about the last month of March and the 1st of April. And after that, the curve slowed down like very, very much. And it's like the curve was completely flattering for like whole June. And here it started to raise again. Well, maybe you think that it's getting higher, but not too much. But I want you to just to see the change in 1 week. So here you have the 20th of August, and now I want you to see the day of today. This was the cases of yesterday, and it was the 28th of August, and the number of cases of positive cases was like much higher than the number of cases in the first wave of the coronavirus pandemic here in Spain. So I want you to think, what is going to happen with this wave? How is it going to work here now? What is going to happen? And that things. Well, now that you see the curve lies very good flattering. I want you to see now how the incidence varies from one city to another, because not all the whole country works in the same way. And of course, there is an epicenter of the pandemic. Where do you think the epicenter is? Well, it's like very logical, you have seen the news, but the epicenter was mainly in Madrid and in Catalonia. Here you have all the cases during the whole pandemic, and in Madrid there have been 108,000 cases. So it's like too much if you compare it to these regions like Andalusia or Castilla León, and it's like very different. So right now we have these cases and this number of deaths, and as you know, Spain is like one of the countries in the world, not the highest one, but the cases and the deaths were like very, very high. Also here you can see like the graphics of the different regions, and it's like very small when you can see the numbers of the regions. And for example, here in Madrid is like very high. Also in Barcelona is very high, the number. So I want you like to think that the incidence is not the same in all the regions, and the pandemic has worked like in a different ways, and not all the regions have like suffered that much. Well, now we are going to like to understand the topic better. First of all, the risk factors is like a very, very normal thing. So it's like, which are the risk factors of the COVID? It's like obesity, smoking, drinking weekly, and hypertension, and high incidence of diabetes. Well, this is risk factors that we have like to take care with that population in order that they don't take like more factors than they really have. And now, which was the situation of our hospitals during the first wave of the pandemic? In the first wave of the pandemic, we have lack of IP in most of the hospitals. This means that most of our professionals were working without any personal occupation of individual. So they were like taking all the risk of the COVID, and after that they were taking it to their homes. Also, the hospitals were oversaturated. There were like a lot of patients. The units of intensive cares were like oversaturated. There were no beds, so it was like very tough for all the professionals that were working there. Also, the hospital management was like catastrophic, and there were a lot of political errors. One day they were saying one thing, and then the other day they were saying another thing, and it didn't allow them to work in a very good way. And also, the number of cases of the professionals that were working in the hospitals were 55,000. So it was like 13% of all the cases that were registered in Spain. It also has death like some people, not too much, but has death some of our professionals. After that, which are the social measures that we take in Spain? Well, compulsory. There is a compulsory face mask. We have to wear it like everywhere, and it's for everybody age 6 or more. And I think that some of the old people like with 65 or more aren't allowed not to wear them, and that things. Also, we have to maintain the social distance. Reduced opening hours in nightlife establishment. I will talk about it later, because now in the new measures they are completely closed. Availability of sanitary gel and solution in tourism business, and services for regular cleaning of hands and surfaces. So if you go, for example, to a public transport or that, you can like take the gel, you place your hands, and you continue. And reduce capacity in enclosed spaces, pavements, cafes, tourist attractions, and cultural activities. And as I have told you before, yesterday most of these measures changed. So here you can see some examples like the cleaning routine. You have to wash your hands if you go to the supermarket and to the public spaces in order to kill the virus and disinfect your hands and everything that you touch. You have to maintain the social distance. Maybe this is like a very difficult thing to do in places like Madrid or Barcelona, because if you have to go to work in public transport, you have to go, and the place is like very small, so it's like very difficult to do, and you have to wear your mask in a properly way, and that things are like the social measures that are taken. Well, now when started the state of alarm, the lockdown, and which were the phases of the desescalation. I'm going to talk about them like very briefly. Well, the state of alarm started the 15th of March of 2020 with 4,200 positives and one deaths. This was like criticized because the number maybe is like too high to start the state of alarm, and all the measures should started like sooner than they started, because maybe it was like too late for everything. That, well, this is how they work, so we can just like learn about it. And how work the state of alarm? Well, the limitation of citizen mobility. We cannot go out of our homes. We were like in a completely quarantine. Cessation of commercial and economical activity, because like more of the bars, hotels, all the commerces were closed. Also closed the leisure, educational, and cultural venues. All the schools were closed. You cannot go to any educational center or anything like that. And the government provision of private entities. What do we understand for this last point? It is that the government take into their power things like, for example, they hospitalize hotels in order to take patients to there, and also they take private hospitals and they put it in the public provision in order like to have more space and not to be so oversaturated as they were. And now we are going to talk about the education and the universities. What happens in the first wave with the schools and the universities? Well, all the educational centers remained closed from March 14, and the end of the course was in a non-face-to-face way. So we did the exams in an online way, and everything was online. And also there was autonomous competence. What do I understand about that? It means that it was not the government the one that has to say how it's going to work. It's like the school is the university that is the one that say how it's going to end the course. So it was like it was like a mess for us, because we didn't know how it was going to work, and no one tell us how it's going to be, and it was like very, very catastrophic. Well, how it works, the de-escalation plan. The de-escalation plan started the 4th of May. It was in 4 phases, and each phase was supposed to be 2 weeks. After the week, each region was like put in an exam, and they have to pass several indicators in order that they can take the next phase. First of all, I'm going to talk to you, well, here, the different phases and what can we do in the different phases. And after this, I will tell you like some indicators that the regions have to pass in order to be allowed to enter in a new phase. Well, the phase 0, all the country starts phase 0 in the 4th of May, and it was supposed to last 1 week. What can we do in the phase 0? We can go to the hairdresser with an appointment. We can go to do exercise in the street but in several hours. We have like a calendar kind of that. We also can do short walks. It was supposed to be 1 kilometer, and restaurants can serve takeaway food. We cannot go to the restaurants yet. After that starts the phase 1, and here we can meet in small groups. Hotels can be opened with 30% of the capacity. After that, we start the phase 0, and what can we do in phase 0? In phase 2. In phase 2, we can go to bars and restaurants with a limited capacity. We can also go to shopping centers, and we can go to gyms to practice sports, and we also can go to cinemas, theaters, and museums. And after the phase 2, we have the phase 3. The phase 3, here the nightclubs were opened. We can also celebrate weddings and funerals and meetings and conferences, and we can go to beach. In order, our regions started in phase 0, and then at the end of the week, the government say which region can pass to the next phase or stays 1 week more in the phase. The indicators were mainly like if the cases have increased, if the hospitals were saturated or not, and that kind of indicators. Here we have like the graphic of how it was supposed to work. This graphic was prepared when this desescalation was proposed, so it was like at the end of April or that. And after the end of my presentation, you will see that it hasn't worked like very good, because the new normality is going very, very bad now, and we are starting again all the restrictions and that things. But well, if you follow this, the 13th of June, all the regions started the new normality. Okay, so what is happening now? We are going to analyze all these governmental measures, and we are going to compare them to our future. So, I mean, how is now the present and how is going to be in the future? What is happening with the curve? As you have seen in the curve that I have shown you before, we are facing now the second wave, and we don't really know how big it's going to be, because if you see it, it's going to be like much higher than the first wave. Are COVID cases increasing? Yes, of course. As you have seen they are increasing, but in a very, very quickly way. And now, two things that maybe worry Spanish or tourists, maybe if they are coming here. Is there going to be a national lockdown again? And is there going to be a new state of alarm? Well, I will answer you to these two questions in the following pictures. I will also like to tell you that here we have Fernando Simon, and he's the director of the Center of State Emergencies here in Spain, and he has been done all the conferences every day during all the quarantine and during all this time here in Spain. And well, here you have it. Well, what is happening in Spain now? First of all, here you have the cases with the curve again. Well, the ministry has, as As I have told you, all the regions have their own competence to do kind of whatever they want, kind of that. So the ministry has advised to Madrid that they have to do something. They have to take drastic measures if they don't want coronavirus cases to rise. Because as you know, Madrid was the epicenter of the first wave, but it's also been the epicenter of this second wave. And the other day, the Spanish Prime Minister offers regions their own state of alarm if they need it. And also military were put in for contact tracing. So after that, last week there were new social measures and restrictions, not only social, but here I'm going to show you the social ones because I like the most characteristic. There are also socials. There are also restrictions for most of the aspects of the country, but I'm going to show you these ones. Well, first of all, smoking is forbidden in public spaces. All pubs, nightclubs, and that things are forbidden. They cannot open. And you can go to a restaurant or to take a beer in a terrace, something like that. But you have to be in the table with less than 10 people, and everything must be closed at 1 a.m. Now I'm going to talk to you about what is going to happen with the education and with the university. The education. Well, first of all, this is something that is being like asking by everyone if the school is going to open. So yesterday they have a meeting. The Minister of Health and the Minister of Education, and they say that of course the schools have to open, but they have to take like the right measures in order not to increase all the COVID cases again. So not all the regions are going to take the same measures, but they are kind of similar. And most of the regions are delaying the reopening of the schools. They were supposed to start reopening next Friday for the other next Friday, but most of the regions are delayed for the next 2 weeks. And of course, face masks are obligatory for children and that things. And here we have the health authorities saying that it's important that the reopening of schools, because if not, their generation will be lost and that things. Education in medical students and residents. Well, first of all, I'm going to tell you the medical students is the thing that I know. I'm going to talk to you mostly of my university because it's the thing that I know the most. But in the rest of Spain, it's working like in a similar way. And also, there were a lot of changes with the residents, with the internal residents doctors here in Spain. Well, first of all, what happened in Spain? In the first wave, Spain enlisted medical students to shore up overburdened healthcare system. It means that they take like the 5th and 6th year medical students and they tell them, okay, we don't have enough professionals, you have to go to the hospitals in order to help us. It not only happened with medical students, but also happened with nurse students and other healthcare students. Also, what happened at the end of the course last year? There was autonomous competence for the students. So what is the meaning of that? Most of the courses, the professor upload us like the PowerPoint presentation or something like that, and we have to study the PowerPoint presentation. We don't really get any online education and any online lessons. So it was like very difficult for us to study and to really learn. We did the exams, and the exams were in a very different way than they were supposed to be, but we didn't really learn. And now what happened with the residents? Here, the exams for the residents to enter in the residence was last last week of January, and it was supposed to enter in June. What happened with this? The entrance of the residents was postponed and postponed and postponed. The election of the place where the resident was going to be was postponed and postponed, and the government told them, yes, we will do it, we will do it. And what happened with this? The residents get really, really angry with the Spanish government. So they started a strike that started the 13th of July. And here you can see the picture. And now they have the election of the residents have been done. It was in the last weeks of July. It was in a face-to-face way, and they they get what they wanted to do, and they also strike to demand better working conditions, and they also get some of them. And well, finally, what have we done in IFMC Spain with all this pandemic situation? Well, we have done a lot of webinars, now there are like SCOF sessions and a lot of sessions and that things. And we have done 2 questionnaires that you can see in the Instagram if you want to see them. They are in Spanish, but well, if you are Brazilian, I think that you are going to understand what is written here. Well, SCOMI did a questionnaire to ask the students, medical students mainly, how they feel the end of the course. And well, here you can see the answers, and here you can see the thoughts. And well, that's all. Thank you to hear me, and thank you, Brazil, DENEM-Brazil, to invite us. And if you have any doubt, don't hesitate to ask me, to contact me, or whatever you want. Thank you very much.
Thank you, Lucia. Thank you very much for taking the time to do this great presentation for us and to share a bit of your experience with us. We do have a couple of questions. I don't know if you can read them here in the chat, or you want me to read them out.
Oh, yeah, I'm going to... Yeah, you can read it and I will answer them.
Okay, so first question is, why do you think the second wave is going to be worse than the first? Like, were people not respecting anymore when they reached the nueva normalidad?
Well, the difference between this second wave and the first wave was that in the first wave, in the start of the first wave, the state of alarm was started also. So everyone was in quarantine and everyone was in his home. What's happening now? If they start a new state of alarm now, the economy and everything in Spain will be stopped, and we cannot continue like that. So yeah, the difference between the first wave and the second wave is also that in the first wave, the number of deaths was much higher than now. So the second wave is going to be higher, but we don't know if the deaths are going to be higher or not. And also, were people not respecting anymore when they reach the nueva normalidad? Not everyone, but for example, there have been a lot of parties and things like that, and lots of concerts, and people was not wearing the mask and that kind of things. So there, after that things, you find a regrowth. There are a lot of new cases, and it's like, people, why did you do that? And yeah, I think that's all of these questions.
Okay, no, there's one more. Okay, thank you for answering this one.
Oh, yeah.
There's one more here. Lucia, did the government provide free testing, free hospitalization for people with COVID-19?
Yeah, they provide free testing and free hospitalization. The problem of the first wave was that there were no enough beds for everyone in the unity cares for intensity, the unity for intensity cares. So some people were not there, and it led them it was very tough because there were a lot of deaths, the hospitals were oversaturated, and you go to the hospital and maybe you don't find a patient, and it's like, what is happening? And yes, they provide free testing, but not for everyone. It's like that you have to call them, and then they do the test for you. And free hospitalization, yeah, we have free sanitary system, and the hospitalization is free. I have a presentation of how the sanitary system in Spain works, but I didn't put it here because maybe it was like too long, because also have to talk to the people. And if you are interested in it, just ask me and I will pass it to you and you can read it.
Okay, thank you. Then we can let it available for anyone who wants to see.
Oh, there is another question here.
Yes.
Yeah.
Lucia, do you think there were so many fake news about false COVID treatments?
Yeah, there were so many fake news about so many things. It's like you enter in every social media, even you go to a WhatsApp group and it was like, oh, you have to drink hot water to spell out your COVID. And it was like, hot water, vinegar, why do I have to do that? And yes, there were a lot of fake news here, lots of them. And as a medical student, you read it and it's like, no, it's impossible.
Yes, I think people are asking that because in Brazil, it's been really, really hard for that. So many different medications are treated like miraculous cures and have absolutely no evidence at all. And well, it's really complicated here.
It's also happened here, and not with like medical things, but like with more rural things, kind of vinegar, drink whatever.
It's like you have to drink water every 15 minutes, so the virus will go to your stomach, and there it will be deactivated.
And you will expel it.
Yes. Okay.
And that kind of things.
Actually, I have one more question, if that's okay by you.
Yeah, of course.
In the beginning of your presentation, you said that in the first wave, it was very, very hard for the hospitals to handle the demand of patients and everything. Do you think that in the second wave, it's getting better? Like, are they better prepared? Or it's just like pretty much the same thing?
They are much more prepared now because they know how to answer to the wave, but they are like suffering about what is going to happen because they see that the wave is going to be higher. So I don't know what is going to happen. It's starting to increase now, but I don't know how it's going to be in 1 week, how the hospitals are going to work. But yeah, now for example, they have like a hospitalized places in order to answer, and that things in the phase wave, they didn't have it, and they like to have to improvise to do like a hospital in here.
Yes. Okay.
Yeah, that's why I think it's going to be different, but the wave is going to be higher, I think.
Okay, then I think those were the questions. Thank you so much, Lucia, for taking the time to be here with us and to share your experience. It's really, really important to us. And we're very glad to have you here.
Thank you very much.
You're welcome.
Oh, there is another question.
Okay. Okay, next question. Did the government recruit medical students to work on COVID fields?
They didn't, it was not compulsory, but they called us. They didn't call me because I am a fourth-year medical student, but they called the 6 years. Of course, the people that has already finished the career, they call them, and they don't tell you have to go, but they tell you, okay, you are needed, we need you, and yeah, they called us. And lot of friends of mine have gone to work, and maybe medical students were not so useful because they don't have the personal equipment, but nurses students, they were like, I think that they have done a great work in all this pandemic.
Okay, thank you. Is that it now?
Yeah, thank you very much.
Okay, thank you, Lucia. I'm going to call Thomas and Camille now, who are the neos from France, and see you soon, Lucia. Thank you.
Hi everyone.
Hi, hello.
Hi, guys.
Neos from France. I'm Thomas.
And I'm Camille.
Okay.
Okay,
So
share our
Yeah.
screen.
you can just share your screen and start the presentation, please.
Yeah.
Right.
Oh, just a reminder, if anyone has any questions, you can just type it in the comment section of the video, the YouTube video, and we'll read them to them, okay?
Right.
Okay, I see the presentation now.
Okay, it's working.
Yeah. Is that working? Yeah.
It's loading, I guess.
No.
No, so.
Yeah. So we will present the French response against COVID, like in this presentation, and for in the beginning, we will help us. Will help us with some numbers, the big data, and it was very convenient in France because we have an organization, Santé Publique France, it's called, that just put all these numbers updated in the site every day, so we could follow all the evolution of the COVID pandemic in France. So it was really convenient for us to prepare
Guys,
this.
excuse me.
Yeah.
I don't know if you already started your presentation because we don't see it. There's just a screen that says click here to full screen.
Ooh,
Wait.
yeah, we started it.
Wait, I don't know why.
Again.
Wait, it's loading. Okay, I see it now.
Yeah. Sorry, we don't know why it's not working properly. So does it matter if it's not like full screen like this? Because I don't know how to do
No,
it.
it's okay. We can read it, so it's fine.
Okay,
What?
good. Sorry about
Sorry. I'll leave you guys know.
Yeah, so I was speaking about this organization that would put all of these numbers, and you can see a recap of these important numbers. Among them, the number of new cases in the last 24 hours. So today it was almost 7,400, and also another numbers that is quite intriguing. It's the positivity to the screening test. Like it's 3.9%, and only 2 days ago it was 3.7%. So it's really increasing fast, and that's really worrying all the governments because of this increase of positivity.
Okay, so now we'll just go back to the beginning and how COVID started in France. So the first reported cases, they date back to January 20th, where 30 people contracted the COVID infection. At that time, the government didn't think the virus was going to spread to France, and like they didn't really worry, or like they didn't let the people know about their worries if there were. So there's a plan called Plan Orson in France that's supposed to is set to prevent the spreading of viruses in on the territory. So the first stage was activated on February 23rd because a few people had contracted the infection, and the government got quite worried. But in just a few days, more than 100 people had the COVID infection. So the stage 2 of the Plan Orson was launched. It aimed to prevent the spreading of the virus in the territory, basically. And so there was the prohibition of events gathering more than 5,000 people, and schools started closing down in cities where lots of COVID patients were detected. Between February and March, the numbers kept increasing, and on March 12th, the French president Emmanuel Macron declared that the state of emergency in France had to be launched, and so schools had to close down. Universities also. Employees were encouraged to work from home. Also, an exceptional plan of partial unemployment got in action. Also, for the hospitals, all non-urgent surgeries and medical appointments that were not essential at the moment were postponed. And also, all non-essential shops, restaurants, bars, movie theaters, everything just closed down and stayed closed until a few months later. And so on March 15th, the president declared the state of lockdown, which started in March 17th. And during this address to the population, there was like a quite exceptional speech from the president saying that we were at war against the virus and that we were going to fight it, basically. So lockdown started on March 17th. People had to stay home, only leaving the house for first necessary reasons, such as medical appointments, going to do groceries, or if they had to go to the pharmacy or stuff like this. They also were allowed to leave the house to go to work for those works that were not possible to be done from home. Also, they were allowed an hour out of the house for exercising or walking the dog or stuff like this. But that was it in a 1 kilometer perimeter. In a 1 kilometer perimeter around the house, so it was quite limited. Also, obviously, people had to wear a mask when leaving the house and stay like more than 1 meter away from everyone. Also, the beginning of the lockdown didn't stop the number of COVID cases to be reported. And so in March 24th, we had more than 1,000 deaths due to COVID. And so, as you can see on these graphs, so between March and May, the number of reported cases increased daily, and the numbers they doubled in less than a month between April and May. And so lockdown stopped on May 11th, and so we can see that by May 10th, the numbers were slowly dropping thanks to the effect of lockdown. And so when the state of lockdown was declared, the numbers also kept slowing down. People were still being careful because they were afraid of the virus. They were not leaving the house too much and taking things slow and see how the situation was evolving. The new cases were obviously still being reported as the virus was still spreading and is still spreading nowadays. But life started again in cities. Schools reopened slowly. Restaurants, bars reopened in beginning of June. People were allowed to travel again in July, basically just for summer vacation. So life was almost back to normal. But what about now?
So currently the virus is still in circulation in France, with more and more people tested positive to COVID. And so wearing face masks whenever you go outside has become the new normalcy. And this increase in the numbers of positivity in COVID can also be explained by the access, the greater access to screening tests. That is way more facilitated than it has been before. And hospitals, labs are offering free screening tests for everyone. I don't know if the screening process is free in your countries, but in France it is. And it's all taken in charge by the universal health coverage. There is also a big concern about the back to school, because it has to be rethinked. with social distancing, classes from home, and online university. And really, the main fear is that the coming of a second wave in France, and that would freeze again France totally, economically, among every other possibility. But we will just have to wait and see what the future brings us. Regarding all the governmental strategies regarding the hospitals and patient care, at the beginning, it was mostly a huge campaign on how to prevent the spreading of the virus through barrier gestures. There were many TV spots to aware all the people of this virus, how to prevent it, and all of this. But it wasn't enough, so the state had to reorganize a lot of his society and hospitals and all of this.
So yeah, so first of all, there was a redefinition of everyone's role in the hospital. So everyone would know exactly what their missions were, and so they wouldn't lose time when they didn't have that much time. There was also a redesign of timetables with longer shifts and modified hours to fit the needs of patients even more than usual. Also, there was a reorganization of the layout of the hospital. So recovery rooms, non-essential wards, they were turned into intensive care to welcome the growing numbers of patients. Also, there was the creation of COVID centers. So those centers were only welcoming possibly positive COVID patients, just to avoid them coming across other patients who would maybe be more eager to get, not eager, but like more disposable of getting a worse infection due to COVID. Also, there was the creation of military hospitals to support the growing numbers of COVID patients because the hospitals didn't have enough beds for all those patients. Patients were also transferred from one hospital to another one. So basically, there were red areas in France where the virus was spreading, increased like really, really fast. And where the hospital couldn't take any more patients because they didn't have rooms to put them. So those red areas, the patients from these areas, they were transferred to green areas where there weren't that many reported cases. So for example, in the Grand Est in France, so it's near Strasbourg, Mulhouse, I don't know if you know where this is, the hospital couldn't support the amount of patients, so they were transferred to the south of France, they were transferred to Belgium, to Switzerland, to Germany, where they could welcome them. And so they were very creative with all means of transportation. So even buses were turned into movable intensive cares, basically. So they were quite efficient, and mostly in some cities, they didn't have really COVID patients coming from their cities. They just welcome COVID patients from everywhere else.
Fortunately, there were some issues in the healthcare system, as I think in every country, but there was a big, huge lack of face masks, leading to the rationing with just one available per health practitioner per day, while it was recommended to wear it for only 4 hours. And there were also a lack of every equipment, such as respirators, overblouses, disposable straps, etc. All these things essential to medical care were lacking in every department. Another point we wanted to draw to your attention was all the effect of mass media, because since the pandemic started in France, COVID was in everyone's mouth, but no one knew a clue about the virus, how it was spreading, the consequences of it. So everyone was just taking a bet on what was real and was not, what was the truth. So the media here just thought it was a gold mine for them, because every day they were presenting all kinds of theories on its origin, on its effects, on its spreading also, and also of course cure for the infection, as it was talked about from Spain. But every day it was a bit changing, and we couldn't know what was true or what was not. So it was a bit complicated we were a bit overwhelmed by all of this information. And one of the main debates was over the researches of Professor Raoult from Marseille. He is a specialist on infectious disease, known worldwide, and he talked about hydroxychloroquine, and he really said that's really the treatment against COVID-19. And since there has been way more researches in order to know hydroxychloroquine, and the relevance of these studies has been and still continues to be debated among the scientific and medical community, because among the population it has raised lots of hopes, but also had led to individual and collective imprudences you couldn't imagine they were possible. Another thing is the impact on environment of the COVID in France. So globally, we have witnessed a drop in nitrogen and carbon dioxide emissions of 50% almost at a European level. And so for us, it's really encouraging to see that happen regarding climate change and environment. And the lockdown also encouraged people to do some sports. And now that the lockdown is over, use green transport such as bikes, or even work from home, and then so avoid travel by planes. But beyond all of these drops, we have to look at other parameters, and indeed looking at use of phones, streaming platforms mostly, it really increased during this period, balancing all these benefits of the lockdown. So it's really a great problem when you know all the energy all of this is draining from the earth. And now that the lockdown is over, people seem to go back to their old habits, consuming way more than before this crisis in order to balance this lack of consumption during the lockdown. So we're not sure about the real consequences of the virus, but we couldn't jump to any conclusion really soon. We couldn't jump to any conclusion. And we talked about governmental strategies before, but on this point, there were not many positions taken in this direction. And it's really quite unfortunate when you know that French people, and especially young ones, have voted for representatives at an European level and municipal level too. They had voted for representatives involved in an environmental party. So it's quite a shame that there is no governmental strategies that are in this direction.
Because we had the municipal elections during lockdown, so they had to be postponed. But the first round happened still, but the second round was delayed because of the lockdown. So the results came after the lockdown, and yet the environmental parties were much more present than usual.
Yeah, and we don't know if that's the same in your countries, but we really have the impression that we as humans have short memory. And really, the last word on environment, just think to cut elastic bands when you throw away your mask. Just to save, I don't know, turtles, but do it, please. Then we will talk about the reaction of the French population.
So first of all, we'll talk about French resilience. So French people, they are not really known to be good students. They quite push the they're trying to push the boundaries and see wherever the government is going to go to push them back, basically. So the government, because the restrictions were not being respected by the population, the government had to take actions, and they put financial sanctions on people. So if they were not respecting the lockdown rules and stuff like this, they were fined, basically. If they were like out of the 1 kilometer area, they were also being fined, and it was like 185 euros. So, and it kept getting higher if you got sanctioned more than once. Also, about school and children, obviously education can't be stopped because just of a pandemic. And so obviously as school were being closed, children kept learning but from home. Parents were doing the teaching. They were in touch with the teachers who was giving them giving the parents the work that they were gonna give the children, basically. But it put a light on underprivileged children, because they didn't have access or uneven access to the internet because it was a problem, because teachers couldn't get in touch with the students, and so they were being left out of the education, basically. But to find a solution to this problem, the Ministry of Education broadcasted on TV classes for all students. So every week there was a schedule. So like, for example, from 9 to 10, there was a class for first graders on learning colors. And then from 10 to 11, there was a math class for ninth graders. So they were really trying to reach all students of all age, of all grade, like school grade. And so it was a good way to give basic education during a pandemic if the students couldn't have access to a better situation, basically.
About working people, we talked about before about unemployment, but actually 2.1 million employees were put out on partial employment, and they received 70% of their salary. First, firms perceived lots of financial support from the government to avoid them having to fire the employees they couldn't pay anymore. However, because of the lockdown and the restrictions put on them when lockdown was over, companies had to let some of them go, or will have to, as the economic situation was and is challenged right now.
September is going to be bringing quite complicated situations for companies, because they won't be able to pay their workers anymore, because for now it was like a big strength state because it was summer vacation here. So now that September is coming, everybody's going to go back to work, and we'll just have to see how it goes. But it's looking not really good. So yeah.
Yeah. Regarding the elderly people, this crisis was also really hard on older people. Indeed, either they live alone or they live in medical institution. But in both situations, this virus completely impeded families and at times even caregivers from sharing moments with them. And most of the times, these people, they consider they only live to enjoy the presence of their loved ones. So it was a really big issue in France. So we will quickly give you a testimony of an 80 years old man who is living in a medical retirement home.
So that man is 80 years old. He's living in a retirement home. He's sharing a room with his wife, but so it was tested positive to COVID-19 while living in a retirement home. The home had been closed to visitors since the beginning of March, so they hadn't seen any family or no friends for quite some time. Only nurses, caregivers, and doctors and physiotherapists were allowed to come and go, basically, but they had to take sanitary measures. So when lockdown started, he was confined in his room with his wife. So they were not allowed to leave the room, not even go outside to get some air, not even walk the corridors. So basically, they just spent 3 months in one room, so with his wife. As a preventive measure, the residents were tested quite often to make sure they were safe and had not contracted the virus by in some way. So in the house he was living in, some patients had been reported as COVID positive, and so some of them had to be hospitalized. Most of them died. So that man was tested for positive for the virus on April 15th, but surprisingly, his wife was not positive to it. So we don't know how that happened. So in a way to protect his wife and to prevent the spreading of the virus even more, he was isolated to another room for 2 weeks without seeing anyone, not his wife. So there was nothing for him to do in the room. He got quite depressed, really depressed, saying things like, "This is the end for me, I'm never gonna make it out." So this time was quite stressful for him, also for his wife, because she was really worried about her husband, because they had never spent that much time away from each other, so it was quite difficult. So, and then the 2 weeks passed, and then he was able to rejoin his room and his wife, and now everything's going as good as it can be. But they were, and now in medicalized retirement homes, they can get visitors again, but it's very regulated. They don't see their family very often. It's quite a very difficult time for them, because for old people in general, because they really enjoy the company and sharing time with friends, families, and everything. So it's quite complicated for this population.
Yeah, and this has not only have an impact on mental health on elderly people. It also impacted the mental health of all French people. It includes anxiety, sleep issues, depression, like this man. But there is two main causes of it that can explain it. That's first, the fear of the virus in itself, the fear to get it, and being even stigmatized about it. And then we have, on top of it, the lockdown and its isolation. So the impact on mental health was not particularly seen among elderly people, but really among young people and sorry, I forgot what I wanted to say, but among precarious and young people. This deterioration is slowly beginning to reverse itself, but it's still impacting all these people, and we can predict when this impact will cease completely. And we can also see that it also impacts now the emergency services, particularly the psychiatrist one, because they have to take care of all the patients that neglected their health during the lockdown, and so that they waited way too long to pass to these services. So it really delayed all cares in France.
So now we're going to talk about medical students during the crisis. In France, most of medical students swung into action during the crisis. About 44% of them, they were really eager to participate in the effort led by the healthcare system. Basically, they were helping voluntarily, They helped paramedics regulate the calls for about 30% of them. So they were just doing like, they received the calls and they were like saying to people, you should do this, you should go there, and depending on what the patient was telling them. They also made sure that barrier gestures were being respected by the population at the entrance of the hospitals. So they were like giving them face mask, hydroalcoholic gel also, and taking their temperature to be making sure that the people coming into the hospitals for other reasons and potentially being COVID positive were not gonna get the COVID virus in the hospital also and gonna be bringing it. They also did lots of paperwork. They were doing like secretary work in hospitals, in clinics, for GPs, for whoever needed basically that help. Also, for most of medical students, basically, we can work in the hospital as caregivers and also as nurses, depending on the year of study we're in. So there were lots of students helped out like this as a job also, but also voluntarily, depending on the department and the cities. But yeah, so basically students were really eager to help and to join the effort in fighting COVID. So yeah.
Yeah, and they really felt they were helpful to the society, but they really deplored the lack of amenities, as we talked about before. And it's really a point that's recurrent, and that I think we try to work on if a next wave is coming. And another thing for med students is the impact on studies and on all the exams. It's that while we were helping in hospitals, we were also supposed to keep learning all of our courses, but there were so many things that went in a way that we didn't have the time because we were at the hospitals or doing other things to help in the hospitals. And even if we had the time, courses provided by professors were professors were supposed to make available online courses, but it happens to not be the case for every one of them. So it was really hard to keep this learning process when you have the lessons you should have. And regarding internship, obviously, like all the objectives we have in all the years, because not all the internships are the same in all the years for us. So all these objectives were totally not achieved. And even sometimes like the internships were canceled because of the virus, and they didn't want the students to go to hospitals because of the virus.
So now we'll talk about student initiatives. So everywhere in France, people got creative in finding ways to help the population in not a medical way, basically. So, and how to make life easier for people working in hospitals. So there was like a service to babysit the kids of healthcare workers. So that was taken care of by students, and they were not medical students, but just students in general. There was also a Facebook group that was created with lots of ideas that could be done during lockdown to keep the kids busy, to keep the family, like to keep busy, basically. There was also a creation of a
website that was for all the patients that were non-French speaking. So the students just translate all the sanitary measures and all the barrier gestures, so they could understand them, even if the caregivers were not speaking their language. So I think it was very helpful, and all of these activities helped the link between all the students, I think, and they have shown the government that the students are really helpful and have really ideas to make things move and are not just passive to the situation.
Also, there was like students who volunteered to do the grocery shopping for people who could not leave the house because they were old and they would be potentially more harmed by the virus, or people who had diseases or whoever needed the help. That helped. People were here to help, and there was also the production of face masks, reusable face masks that got spread quickly through France and probably other countries too, to feed the needs of the population.
Yeah, and the last thing we wanted to talk about was the outcomes of this pandemic on the French healthcare system. So this crisis basically has shown the government that its system was really not working and that it has a lot of flaws. So it led to an assembly, like it's called the Ségur de la Santé, and it was gathering ministers, student representatives, like our association was there, and a lot of other contributors in order to better the efficiency of our healthcare system. And the decisions coming from this assembly will really help reassert the value of healthcare professionals, unblock funds for them, and really simplify their work. But it also led to new positions regarding medical students, like the increasing of allowance and the enhancement of training and internships. So it really has great impact. Like, not great to say this, but it had a great impact on our studies, but also on all the healthcare system in France.
So yeah, this is a quite historical moment actually for France. The Ségur de la Santé is quite a turn for the government and for the hospital too, because it aims to open more and more beds, to revalorize the people working in hospital, for the consideration, for the salaries, for the timetables also, to make them more arrangeable, and for students mostly, because the increase of the allowance it quite doubled actually, because in medical students from 4th to 6th year are being paid in the hospital, but we are being paid less than a normal student doing internship in whatever company, and so the salary is increasing, but it's not reaching the expectations of ANEMF, but it's going to be still working on, and the Ségur isn't over, and so we just have to wait and see what the future brings, basically.
Yeah, and that was our last word.
Yeah, thank you for watching.
Yeah,
we hope you liked the presentation. And
it was not too long.
Yeah. So yeah.
Okay, thank you guys so much for the presentation. It was really interesting. All the reflections on the environment, the mental health, and so many interesting topics and necessary things we actually need to talk about, and maybe we're not talking about it enough. So thank you very much for it.
You're welcome.
And we have a couple of questions. If it's okay by you, I'll read them to you so you can answer them. Okay. So the first question is, why do you guys think the pandemic hit France in a really severe way in the beginning?
So the hospital wasn't really prepared, and so it kind of was like a big hit, and that's why probably it was really severe. Also, people were not really aware of the virus spreading. People were like, yeah, we won't be concerned by the virus, basically, and it's not going to get to us, and we should be fine. But it turns out we were not fine, and so the government took quite some time to get things in action and things moving, and so yeah, maybe the long response time wasn't really helping, probably.
Yeah, and it was also very strange because all the territory was not touched the same way. Like we talked about the Grand Est, it was really a disaster. But in our regions, like we're more from the south, and it was quite okay.
Quiet, yeah.
Yeah.
There were not many cases,
Yeah.
but Le Grand Est and Paris were really hit hard, and they were facing a lot of issues, basically, and
and
they were struggling.
There were not many explanations for this difference, I think, in the territory.
Okay. Okay, thanks. Next question. Is the government supporting the families of doctors that eventually died fighting COVID?
I know they were helped when the family of those people died, but I don't know if they helped them like really. Yeah, I don't really know actually. Like.
Yeah, I'm afraid I'm going to tell.
We don't really have the answer to that question. We're really sorry. It would be interesting to
no.
know the answer, but we just don't have it. Sorry.
No, it's okay. It's okay.
But we didn't hear something.
No.
Well, it was not known by everyone that something is done to the family of doctors. But so
No,
I think not that much, but yeah.
Okay, thank you anyway.
Yeah.
But yeah, vision was in the way.
Okay, then next question. Did the government give any amount of money to support the poor people during the crisis?
We don't know about that. We do know that associations helped the poor during the pandemic by giving them shelter, by giving them food, a warm place to stay, just like face masks and stuff. But the government, as far as we know, did not do that much in that direction.
But I think you also have to know that in France, the distribution of the money is really helping the poor people already. So maybe there were small supports during the crisis, but the things in France are really pushing in order to give money to the poor people so they can have a better condition of life. So I think it was not something only done during the crisis, but maybe it was maybe a way more done during the crisis, but it's already done along all the year, I think, and not
especially for COVID.
Okay.
Well, like a work of all time, basically.
Okay. Here in Brazil, we had a emergency help of 600 reais, and it was like really hard. It was like a really tough fight to get it. The president didn't want to give it. He thought 200 reais were like enough, but it's obviously not. And I mean, 600 is not enough at all.
Yeah.
And it's still being like a pretty big fight for us. I think that's why it's so interesting for us to know how other countries are dealing with that too, you know?
Yeah.
Okay. So next question. What is the future of exchanges and COVID impacts in France?
Hopefully, we're going to have exchanges. We're doing everything we can to make sure that they happen, but if the sanitary situation doesn't allow it, then we'll just have to cancel again. But we're welcoming students starting in September, so this is a good thing. But yeah, we'll just have to see.
And I think we're trying to prepare if the situation gets worse. We will be more prepared, like to reimburse students and all this kind of stuff. It will be easier for us to do this because, like, at the beginning of the year, they weren't prepared for this, but I think we're more prepared, and like we're neo-born in COVID, so yeah. Basically, I think we will be able to handle another COVID.
Yeah,
okay.
Hopefully we won't have to. Really
Okay.
for that. But yeah.
Thank you. Okay, we have one last question. Do you think the government is ready for a potential second wave?
It's preparing for it. I think they'll be more ready because they know how to deal with COVID. They know how to take care of the patients. They know they don't know everything about COVID, but they know how to take care of the patients with COVID. So I think they learn from their lesson. Basically, they are probably more equipped. They have rested healthcare workers also because they were really tired during the pandemic because they had to work so much. So yeah, if they have to face a second wave, the hospital knows what to expect basically, and so they can prepare accordingly. And hopefully, if a second wave hits France, we will be able to be more efficient and just fight it harder than ever ago.
Yeah.
Okay, I have a question, if it's okay. Okay. In your presentation, you said that your president said in the beginning of the pandemic, he said that you were at war. Here in Brazil, we hear that a lot also, but it's been kind of used as something to justify taking shortcuts in the scientific process, you know? So they're like, oh, we are at war, so we gotta like release all the medication because people are dying and we can't stop that and just like let everything go. Is that also affecting France, like this excuse for taking shortcuts?
I think at the beginning it was not the aim of it. Like I think at the really beginning of it, it was to make the population realize it was something serious because, as we said, all French people were like, oh yeah, that's just a virus. Like we're stronger than ever. We will not die from this. So I think he really tried to use these words for the French population to, in order for them to understand it was something serious and it couldn't just be prevented with, I don't know, like pills or something. So yeah, I think at the beginning it was this, but sure, another opinion. And yeah, maybe on all the decisions, like because he said all these climates, like the people were more willing to do all this the stuff it was or the government was preparing, but I don't think it was as hard as you described in your country.
Okay, we have one last question actually. Someone just sent it. How do you guys think French people are facing the pandemic? Thanks.
They faced the pandemic quite well, even though they didn't respect the restrictions. But the idea of a second wave, people are not like, they really don't want that. They don't want to be locked down again. They don't want to see everything they've been regaining in the last few months back to where you can't go out of your home. So there's a big fear and people just don't want to believe that a second wave's coming. And basically, yeah, I don't know if it's like, if people would really respect the lockdown and stuff like this if the second wave is to come.
Yeah, and I think the government has really understood this because they are not working on any plan of entire lockdown on all the country, because they know that on all the people will not respect it, and of course it will not be good for the economy. So I think they really understood that the population was not ready to do this again. But in general, French people tend to not respecting that much the rules, and so there is two extremes. I think like the people who are listening to the rules and maybe sometimes inventing some more then they should apply to them. And there is also people that are not wearing masks anywhere, not washing their hands that often. So I think there is not quite people in the middle that just do the right thing. So that's really hard to cope with this kind of situation, I think.
Okay. I guess that's it then. We don't have any more questions. Once more, thank you guys so much for taking the time to share your perspectives and really like.
You're welcome.
Thank you
Yeah,
for
that's the thing.
To be here tonight.
Thank you so much.
Thank you. And now I'm gonna call Sarah, who is the know-how for Sweden. Hey.
Hey, hello everyone. Thank you for inviting me, first of all. My name is Sarah Ebadi and I am the National Officer on Research Exchange at UFMC Sweden. I am a medical student, currently through the second half of my 4th year. I will just start right away by sharing my screen. So let me know if you can see this in full. Oh,
yes,
nope.
I can see it. It's not in full screen, but I can see it.
Do you see it in full screen now?
Yes, perfect.
Oh, that's awesome.
Okay,
well,
I'm gonna let you go.
Yeah, thank you so much. Local time is 22:28, so I hope I don't look sleepy yet. My presentation won't be as long as the one of my previous friends, but I will take you through the current situation in Sweden, what the government did, how it affected medical students, how people responded to that, and a bit the effect on UFMC Sweden and what the future holds for us. So let us start with some quick facts. By today, we have actually 83,958 confirmed cases, and so far we have lost 5,821 individuals. In this graph that was published by the Public Health Agency of Sweden, you can see the number of cases every day, starting from the very first time where we recorded our first case, which was in March, until now in August. And you can see here we have a clear top peak somewhere in June, where we reached almost 1,800 cases per day. And I think later on in this presentation, you will discover why is that. But to tell you a bit on the start of this pandemic, which was in March, or when it reached Sweden, this was due to the fact that many Swedes were on vacation in Italy. And by that time, COVID-19 has already reached Italy. So many Swedes came back with the virus and, they did spread it all over the place. And that's where everything started in Sweden. And this figure that was published in the latest report by the Public Health Agency, you can actually see, this is of course the map of Sweden. It's divided into different regions that exist in the country. And what the figure is trying to show you is the incidence of COVID-19 per 100,000 residents per week. And this data is 2 weeks old, and it refers to the weeks 30 to 33, basically from July 20 and until 3 weeks after that. And we can clearly see there's an increase in the incidence, mostly in the southwest of the country, in the south and in the island as well. So unfortunately, we are still seeing increases on a daily basis. So what did the government do about that? You might have heard of the very unique approach that Sweden has taken in order to tackle COVID-19, and that did not include a quarantine. We never went into a lockdown, as pretty much the whole world did. And we do not have to wear any face masks. Face masks are not obligatory until now. However, you see many people in the country wearing face masks, but you see many others not wearing any ones. This is currently a debatable issue. The government is still debating whether to enforce it or not, but right now it's an optional choice. And I would love to elaborate here a bit, because unlike most countries in the world, which are regulated by the government, this is not the case in Sweden. Because the government here has done two things. First of all, trust its people to the full, to keep themselves safe and to keep the society safe. And then they trusted the people with the knowledge to take the decisions and do the right thing. And I don't know if you have heard of this person before, but this is Dr. Anders Tegnell, and he is the state's epidemiologist who works for the Public Health Agency of Sweden. And this doctor is pretty much behind why we never went into a lockdown and the other restrictions. And of course, he has based the decisions on science and facts. And here I would love to quote our Prime Minister, Stefan Löfven, which in his latest speech, which was last week, 21st of August, he said the following: "We must remember that this pandemic was unexpected for the whole world. Therefore, I think it is wise to await the Corona Commission's conclusions once we have seen the whole process. With that said, I think we chose the right path." So we have the government's blessings. And of course, the Corona Commissions that he is referring to are the European Union Corona Commissions. So we have no lockdown. We do not, it's not obligatory to wear any face masks. What has been done in this case? Well, of course, there has been some measures that were implemented. I am not going to list all of them because, of course, they will be too much. So I have some examples here for you. Again, they come from Folkhälsomyndigheten, which stands for Public Health Agency. In the beginning of the pandemic, schools were closed for 4 complete weeks, which is equivalent to 1 month. But what I can say right now is that schools are reopened and we are back on track as usual. All the lectures were transformed into online lectures, and this applies to both schools and universities. At the time schools were closed, universities still have online lectures. Then there were some travel restrictions that were implemented. And here I would love to elaborate a bit because, for example, non-EU citizens were not allowed to enter Sweden due to the pandemic. However, people living in Sweden and Swedes, they were advised against any unnecessary travel, but they were still able to travel, domestic travels inside Sweden or even outside of Sweden, unless they were met by the restriction of the destination countries. Because in so many cases, we were actually criticized very much because we never went into a lockdown and we're not wearing face masks, etc. So many Swedes were denied entry into several countries just because we never went into a quarantine. I can also name the fact that trains and buses were departing less than often. And on the trains, you can actually no more book all of the seats. There were some seats that were blocked by the companies in order to make sure that no one can book these seats and to ensure social distancing on board. Then, of course, there were restrictions for restaurants and bars and stores who had to control the number of people entering the stores. And, for example, the restaurants had to reorganize, the tables to maintain a social distance between people. Moreover, gatherings that involved more than 50 individuals were prohibited. And here comes a twist, actually, because even though that this restriction did exist, we did see in the beginning of the Black Lives Matter move many demonstrations in Sweden that involved more than 50 individuals. And even though they did start with social distancing and respecting the rules and the regulations, they did end up in chaos. When we come to the healthcare sectors, no more visits were allowed to patients at hospitals or at retirement homes. Military hospitals were created, and in many cases, digital apps were used. Doctors had to make the consultation online. And luckily, digital health is not something new in Sweden as well. It was established long before the pandemic. But this pandemic has increased the use of these digital apps and made people, it's like forcing the people to use them in some cases. And here I would like to name the fact that medical students from all over the country did volunteer to help the healthcare sector in this, and many did do that. In general, there were recommendations for the whole society to keep distance, follow the hygiene rules, avoid unnecessary travel, and work from home. And actually, many doctors from healthcare facilities did work from home. Again, they did use the digital applications to conduct a consultation and an appointment, and it did work pretty well. So how did people respond to all of these restrictions? Well, I have to say that the people's response depends on two things. First of all, it's a personal responsibility to keep yourself safe and keep the others safe. And it depends also on who you are dealing with. For example, in this picture, you can see this is the famous IKEA store, and people had to actually queue in order to enter to the store. But in other cases, you see this, it was summer, it was hot, people want to have fun, which is totally fine, but something seems to be missing. And you can actually see here this yellow chart, which clearly says that now we need to keep distance. But obviously, that is missing in many cases. And in some cases, it was so extreme that some restaurants had to close down. They were forced to close down. Here you have an article which I brought from a very famous newspaper in Sweden, Aftonbladet. And what it's trying to say is that 5 restaurants were closed down in the city of Stockholm because they were not obeying the rules, they're not following the regulations. So how did this affect medical students? I can speak mostly of medical students because that's what I am. And I'm pretty sure this applies to most of the university students in the whole Sweden. So as I have already named before, all lectures were transformed into online lectures. This is something I liked, or my introvert soul did like to begin with, but unfortunately it's getting a bit annoying because I think it's starting to be hard to focus online, but I guess we have to live with it. And as a medical student, unfortunately, we get to see fewer patients because most of them are now either via the telephone, or online. So we get to meet fewer patients than usual. And in some cases, we do not get to be in operating rooms. And this is very sad for me because right now I'm studying a surgery course and I want to be a surgeon. And not being able to participate in operations is very disappointing for me, but I guess I have to live with that. And the last thing that I want to talk about is the examinations. Due to the pandemic, all the examinations are online. This is something very new for medical students. We have never had online examinations, but I can pretty sure say that the university has done a tremendous job to make this work. I don't think everybody agrees with me here, at least from Sweden, because it's different from one course to another. But thankfully, it did go great for me, or it is until now. And of course, here I'm just talking about the physical effects on medical students, let alone the mental health effects. Many students were maybe planning to move out, to meet new friends, start a new life. Seems like all of these dreams are just crossed now until further notice. So when it comes to IFMSA, where of course we are also affected just like everybody else in the whole world, unfortunately we had to cancel our national GAs. We have so far canceled 2 NGAs. We did as well cancel our summer camp, which was supposed to be in June 2020. And maybe what's most heartbreaking is the fact that we had to cancel all the exchanges, both for the incomings and the outgoings. And this is very sad because in Sweden, we only host students during July and August. And the same thing applies to my outgoings. They can only fly during July and August, which means that my students have to wait 1 complete year in order to be able to participate in any exchange again. But what is the future actually holding for us? Well, when it comes to IFMSA, I'm very glad to announce that we are planning an online NGA. It is supposed to be sometime in November. The date is not set yet, but we are planning and working on that. And then when it comes to exchanges, well, I don't think we can predict how the situation with COVID-19 will be in the future, but we are very hopeful. We are hoping that we will be able to host an exchange next summer. We did succeed in postponing almost all of our contracts. So my students who didn't fly for an exchange this summer will hopefully be able to, if nothing stands in the way, they will be able to go on an exchange next summer. And moreover, we have signed new contracts with new NMOs whom we have never collaborated with before. So I'm pretty sure some students will get to experience new exchanges somewhere. But what I would like to say is, unfortunately, there won't be as many spots available as last year or the last season, because, as I mentioned, we had to postpone almost all of our contracts. So there will be fewer spots available for people to apply for. But we are not changing the application. We are not changing the opening of the application form. We will still open it in the same date in October, because we are not willing for students to miss their dream destination. And when it comes to Sweden, the government has actually purchased a great deal of vaccines, which will be available starting from 2021. And the good news is that it will be optional. So we are hopeful. And with this beautiful picture, I would love to end my presentation, which is very short compared to the previous ones. This was actually taken last August 2019 in Taiwan, and this was post-GA. It's very unfortunate that we cannot meet in person this year, but I hope we can do that very soon. And with that, I would love to thank DENEM-Brazil for inviting me, and thank you everyone for joining us, and I wish you all good luck. Thank you.
Okay, thank you so much for the presentation. It was shorter, but it was just as amazing as the other two were. We have a couple questions. So if it's okay for you, I'll read them and you can answer. Of course,
please.
So first one is, do you think the government will keep the no lockdown measure until the end of the pandemic?
Well, there are no plans into going into a lockdown. Nobody has ever talked about that, not the public health agency, not even the state's epidemiologist. This is obviously our strategy. And there has been talk about, the herd immunity. Is it like economical reasons? But it seems like we are very much convinced that what we are doing is the right thing. And even the people, most people are very responsible and, following the restrictions, even though not all of them, but many are still there. So I cannot see a lockdown on the way, no.
Okay. Next question. Do you think your government is ready in case there will be a huge increase of the cases?
I do hope so. I don't really know, but after the first wave, which was very sudden, I think they might have learned some lessons. Out of the 83,000 cases that we have, only about 2,000 cases were hospitalized in the ICU. Of course, the system was overloaded in the beginning of the pandemic, but I think they still managed to work it out. The system is sure overloaded and everyone is talking about that, but I do really hope that they have learned something from that.
Okay, thank you. Next one. Wait, I'm kind of lost here. Did the government provide free testing, free hospitalization for people with COVID-19?
Free testings were actually not provided. Most of the time, if people, called in and said, like, we are having these symptoms, they were asked to stay at home unless they face severe cases. But however, tests are being provided for healthcare personnel, people who work in the healthcare sectors, but not for people in general, no. And free hospitalization for people with COVID-19, I'm not really sure about that, but I have to guess it's a yes. But to be honest, I am not sure if it was a free hospitalization or not.
Okay. Last question then, I think. Were the medical students recruited to work on COVID fields?
Well, medical students were not recruited directly, but they were asked to volunteer. And a great deal of students did actually volunteer, especially in the very beginning of the pandemic.
Okay. I think that's it then. Thank you so much for the presentation, really. It was amazing. extremely necessary for us to discuss that kind of thing and to know how other countries are dealing with, well, the similar issues that we have. So thank you very, very much for being here with us. We're really glad that you could be here with us.
Thank you very much for the invitation.
Okay. So, as the presentations were going, we got another question for Thomas and Camille. If you can, I don't know if they're still there and they can answer it. No? Okay. I'll wait a little bit and see if they... Okay, they left. Never mind then. Okay, so the attendance form is now open. Anyone who wants to fill it out can fill it out. And in about a month, the certificates will be available in the DENEM site. So to finish, I would like to invite one of our regional coordinators, Mariana, to talk a bit about the Brazilian situation in the pandemic. Mari, are you there?
Hi.
Hi.
Good evening, good afternoon, good morning. I don't know which time it is in all countries that we have present here. I'm Mariana Regazi. I'm a regional coordinator of DENEM. And today, to finish this live, I'll talk a little bit about the situation in Brazil. My speech will be based mostly in the text that DENEM produced to the GA. When we reached in Brazil 100,000 deaths. The situation today, the data, is that we have a total of 3,800,000 cases and 119,000 deaths. Well, Brazil has reached the mark of more than 100,000 deaths now, caused by the pandemic of COVID-19 in our country, which has more than 2,000 million inhabitants. So many different cultures, regions, and people. And that's an important thing to pay attention, because we have a really big country, and the way that impacts each region is really different. The impact of COVID in Brazil was due not only to the potential threat of the virus, but also to the lack of an effective response to the crisis by our government. We have been talking about the power of false words and news in our time, but it may not be easy to gauge how much these factors actually affect people's health. So I'll try to explain a little bit about how was this fake news and the way that our government I forgot the word, if you can help me. How he approached crisis. Approach is good. When people in media asked our president about the deaths and the cases, he would answer things like, "I'm not an undertaking, okay?" Or he would say, "So what? I'm sorry, but what do you want me to do?" And that figures made it clear how reckless the government has been in treating the pandemic as what we call here, and what he says, gripezinha, that would be like a little flu. The Brazilian Minister of Health has changed 3 times also during the pandemic, a fact that adds to the national tragic panorama caused by the virus. So if you have a lot of different information coming from the president and the local governments, like the state's government and the city's governments, how do you want the population to respect the measures that are being put from WHO, the World Health Organization? In August 2020, Brazil enters in 5th month of social distance with more than 1,000 deaths per day, with virtually no state's strategy to control this threat. In addition, we have a high rate of underreporting of cases in the territory. We are the country with the most deaths among the healthcare professionals, and the president was considered the worst world leader in the fight against COVID-19 by the Washington Post. Their attitudes are also detrimental to leaving the country out of alliance with WHO for future treatments and vaccines. So that was another really big problem here. That's the information that came to us. We didn't know actually if we could believe it, because the site a lot of times was out of air, and then it came back with different information, and it got to a point that we had to, our local media and the papers gathered together to provide a different source of information of the cases and the deaths. Right now, we face irreparable losses for our country's history. Indigenous people are the most affected at the moment. These are more than 148 ethnic groups with confirmed cases of the coronavirus, more than 23,000 infected, and 640 deaths. Most deaths are concentrated in the Amazon region, that is northern Brazil, a forest that tries to survive and resist the rampant deforestation that grows month by month with the government's liberal measures. And at this point, I would like to bring attention to the importance of the specifics of the vulnerable population. So, as you may know, Brazil is one of the most unequal countries, and here we have a lot of informal workers that had to still go out to the streets, even with the measures of quarantine, to get their income to feed their family, you know. And there are measures also like, stay home, wash your hands, and use alcohol to clean your hands. There are not able to people that live in favelas, and we have to pay attention to these specifics, because some people don't have access to clean water, don't have money to buy alcohol. So some measures that seem simple won't be effective to all the population. And there's another point also, there is the increase of violence and increase of other inequalities, like from some groups, like women. We had an increase of violence against women, and we also had an increase between the if you get the epidemiology of the people who died of COVID, you can see also inequality by ethnicity. So you can see the inequality by the bigger number of deaths in indigenous people and Black people. Well, but not everything is terrible. On the other hand, we have our unified health system, that is SUS, which provides the Brazilian people with free treatment in the fight against COVID-19. SUS is the key point to discuss public health from another perspective, bringing to light once again the important discussion on universal access to health. Meanwhile, we are still facing the impacts of neoliberal measures aimed at dismantling our health system in favor of opening up space for the private health sector. And something that we can see here, but I think in our world, is this fake dichotomy between economy and health, as if you defend health, you can not sustain other parts of a society, and that is something that is really a big debate here in Brazil, that sustained some terrible arguments of our president against the measures of COVID, during COVID. We at DENEM fight for the right of our people to have universal, free, and quality health. Only in this way we can build a more just society for everyone. Health is not a commodity. It should not be a source of profit. Health is a universal right guaranteed in the 6th article of the Brazilian Federal Constitution of 88. And just to finish, we have to say that 100,000 deaths is in Brazil, and more than half of there were 100,000 deaths in Brazil, and a big part were preventable. That's why we have this space to debate how we are dealing with this pandemic. And it's really, really important to exchange this information. They are not just numbers, they are 100,000 stories, lives, and loved ones. And we are here today in memory of the victims to honor their stories, their families, and their friends. Thank you. And sorry I don't know if you could understand, but I hope you did.
Thank you, Mari. It was great. We could understand, yes. So I guess that's it then. We're coming to the end of the event today. The form is available in the video description. So anyone who wants to fill it out, just go there and fill it. And so I'd like to thank everyone for being here. Unfortunately, Thomas and Camille had to get out, but we're really, really thankful for you taking the time to be here with us and to share the experiences and to share the perspectives and your points of views on how things are going in your countries. Thank you, Lucia. Thank you, Sarah. So I guess that's it then. If you want to say bye.
Thank you for having us.
Thank you very much.
Okay, then.
Thank you.
That's it then. Goodbye.
A DENEM é de quê?
De luta!
E a DENEM é de quê?
De luta!
A DENEM é de quê?
De luta!